Embrace the inclusive spirit. Module 3 of 6. How to communicate confidently with autistic people. Welcome to Embrace the Inclusive Spirit Confident Communication course. This module explores how to communicate confidently with autistic people. It is presented in 4 short sections that cover 1. About autism, 2. Communicating with autistic people, 3. Communicating with families with autistic children, 4. Augmentative and alternative communication. 1. About autism. Autism affects how people experience, communicate, and interact with the world. It is estimated that around 1 in 100 people in the UK are autistic. More men and boys are currently diagnosed with autism than women and girls. Autistic people may describe themselves as neurodivergent. Neurodivergent describes people whose brains work in a different way. Autism affects different people in different ways. Most autistic people have difficulty interpreting verbal and non-verbal language, such as gestures or tone of voice. This means they have difficulties with social interaction and communication. Some autistic people are non-verbal. That means unable to speak. Others have good language skills. Autistic people can also have difficulty recognizing or understanding other people's emotions and intentions, take things literally and not understand turns of phrase, figures of speech, or sarcasm, repeat what is said to them, need extra time to process information or answer questions, have difficulty expressing their own feelings, experience anxiety in social situations or with unexpected changes, find noise, smells, and bright lights painful and distressing, seek to calm themselves with repetitive movement, react badly to no when it changes what they had expected to happen, become overwhelmed and experience a meltdown or shutdown, prefer routine because they know what to expect. 2. Communicating confidently with autistic people. Here are some good practice tips on communicating confidently with autistic people. Not all will apply to all autistic people. Some autistic people may use the Hidden Disabilities Sunflower lanyard or a Just a Minute or jam card to let you know they need a little more help, support, or time. Say less and say it slowly. Use short, clear statements. Ask few questions. Keep them short and specific to enable simple answers. Structure your questions. For example, offer a simple choice such as would you like brown bread or white bread, rather than what sort of bread would you like. Avoid sarcasm, exaggeration, and non-literal expressions, as autistic people may take them literally. Be clear about what is possible or available from the start to avoid having to say no. Reduce your non-verbal communication such as eye contact, facial expressions, and gestures. If someone seems anxious, ask if you can help and how. Give people time and space to self-manage. Offer a quiet, safe space if you have one. Support autistic people's right to use your services should other customers complain. 3. Communicating with families with autistic children. Families with autistic children can find going out or staying away from home challenging. Most children with autism have sensory processing difficulties. This means they may over or underreact to sound, light, and textures. Large open lobbies can be overwhelming, and busy restaurants can be overstimulating. Like autistic adults, autistic children often also have difficulties managing social expectations. This means they are unclear about what behaviour other people expect and can be stressed trying to understand how to behave. Here are some general good practice tips for welcoming families with autistic children. If you have one, offer a quieter table, space or booth. Offer to lower the music volume. Interact with the adults where possible and allow children their space. Limit the number of questions you ask autistic children. Keep questions to children simple so they can give short answers. Offer calming things such as colouring in books or a soft cushion or blanket. Aim for prompt service so the family can leave as soon as they want to. If a child is impatient, allow them to go ahead if you can and sort out any paperwork later. 4. Augmentative and alternative communication. Some autistic people may use augmentative and alternative communication, known as AAC for short, to help them communicate alongside or instead of speech. Here are some examples of AAC. The first is a cardboard flipbook of simple pictures and words. The second is a tablet with an on-screen grid of simple pictures and words. The third is a tablet with a keyboard which speaks the words the user enters. People may also use no-tech or low-tech options such as gestures, facial expression, writing or drawing, or may spell words by pointing to letters. Some autistic children hold up cards that show if they are worried or that they want a drink or a bit of quiet. Here are some good practice principles for communicating with an AAC user. Communicate with the person, not the device. Speak age appropriately. Using non-verbal communication does not mean the person does not understand or is a child. Tell them if it is the first time you have met and talked to a person who uses an alternative method of communication. Ask one question at a time. Check you have understood correctly. Be patient. Making choices can take time and technology doesn't always work perfectly. Be sure the user is done communicating before you move on. Establish how they communicate yes and no. This may not always be a nod or a shake of the head. Ask them what helps to make communication successful. If there is time, ask them to show you how they use their AAC system to help you understand. Respect card and screen privacy unless you're invited to look. Thank you for completing this module. Now move on to Module 4 to learn how to communicate confidently with people who have a learning disability.